very much. Thank you for the introduction. I'm glad to be back online for the doctors in Israel, and this way we can give the support that we want and that I think is needed. This short 45 minutes webinar, I will talk about TM and BDS treatment options with Myosa appliances. After the 45 minutes, we have the options to have a Q&A and some questions and everything what is not clear. It will also be recorded, so afterwards you're also able to receive the recording if needed. Shlomit already introduced myself. Please put off the speaker, thank you. My name is Niels Hulsing. I'm born in the Netherlands. I'm living in Germany since 10 years, and I'm responsible for the European and North and South American Africa market concerning the MRC appliances. I'm originally an orthodontic technician. I was working in an orthodontic lab making all kinds of removable appliances like twin block Frankel bionator. And I was also working for many years with different indirect bonding systems. So my background is almost fully orthodontic. And since 21 years, I'm working for this company. Exactly 1st of June, it was 21 years. The course that I will present today is a summary of a full course that is also available online. And this TM Joint course is available for free if needed. We have on the Maya Research website, we have a basic account. If you register on the website, you can get free access directly to 3 courses, and one of them is the TM Join course. If you want to have access to all online available courses, in total 15 presentations and webinars, you can also subscribe for a month or for a year. The TM Join course, I will summarize and I will introduce for today, is available online again. If we start talking about TM joint disorder, TM joint diagnosis, muscle palpation, and treatment options, we go back many years. Already in 1934, James Coston was already a pioneer on this market. He found some splints, he created some splints to open the bite, to decompress the TM joint, and to relieve pain and jaw clicking. The way he was doing that time, almost 100 years ago, it was really unknown. And in some years after, he was not really accepted. And after the 1960s, 1968, it became clear that what he was saying in 1934 was actually completely right. And the whole study, the whole book of James Coston is available online as well. So go to the course and go to the research and articles, and you will find this publication as well. Another person that is still really popular, and the splints of him are still used daily by millions of people worldwide, is Dr. Gelb. Harold Gelb invented the splint, and also he found out very early that there was a link between TMD, malocclusion, and myofunctional disorders. So there was already a relation between TM joint pain and compression in relation with myofunctional problems, including mouth breathing. Still till today, a lot of doctors are not really feeling comfortable to start treating TM joint because of many reasons. They don't feel comfortable to do the evaluation. It's difficult to find the exact cause. What is the problem? What treatment do I need? What appliance do I need? What will be the result? It's a big, I call it a big gray area that we are working in. And there are many causes that are in relation. Sorry. Also stress, also symptom a placebo effect is related. So sometimes we really don't know what is happening. And sometimes we do a treatment of 4 to 6 months, And after 6 months, the patient is really happy. There is a relief, there is less pain, there is less complaint. She's able to do more things than before. But the moment she will ask you, what exactly did you do? It's very difficult to point out what happened because of the variety of causes. But breathing and myofunctional disorder, malocclusion, stress, trauma, and TM joint bruxing, clenching, and grinding are the main causes of TM joint problems. So from the 1900s, there was a different approach.
The mouth breather typically has the lips open.
Sorry for that.
As we can see it in a small, like a presentation. We can't see it full size.
You can't see it full size?
No, you have to press on something.
Okay, because it was always like that.
From the beginning, yes, but I wrote you and you have to put it yes, like this big kilo presentation mode.
Yeah, I'm trying to I don't know what is happening. One moment. That's the problem with the two screens. Is this better?
Yes, great.
Sorry for that. Do we have to start over again, Noah?
No, it's okay.
The mouth breather typically...
Sorry. So very early in the 1900s, there was a different approach on TM joint problems, and people became aware of the relation between function, malocclusion, and all other causes. Everything is online on the course, so this is just a small summary introduction for the treatment that I'm going to explain later. But already very early was clear that mouth breathing was a main cause, also related to TM joint problems. A reverse swallow, incorrect swallow, tongue thrust swallow also was related to TM joint problems, because in the reverse swallow, we found out that every time the patient is swallowing, the mandible is pushing backwards, and the TM joint is pressing in the condyle, in the fossa. So this way, 2,000-3,000 times per day, there was a compression in the TM joint due to the incorrect swallow of the patient. Also, the relation of mouth breathing and TM joint, reverse swallowing and TM joint, all these publications and research are on the website as well. So in the last, let's say, 75 years, a lot of publications are published, articles are published in relation with TM joint, and I think 80% of them are related in any way with myofunctional problems. So also here, to start a TM joint treatment and to do an evaluation, we have to evaluate on function like swallowing, tongue position, breathing, etc. So this makes that sleep-related breathing disorder are defined as a spectrum of breathing disorder which affects sleep, including mouth breathing, snoring, upper airway resistance syndrome, and obstructed sleep apnea. Many papers have drawn a link between TMD and SRDBs, especially OSA, but the relationship between them is poor understood. In recent years, SRDB have become introduced to the dental professional, thought the creation for a new subcategory of the profession. So we see also, again, what I said, dentists are aware of the problem, but there is still a gap between finding and having an issue and are able to present a treatment. So we think, MRC thinks, with the TM joint appliance and the TM joint treatment, it is a very first phase part of the treatment. It's very easy to do a muscle palpation, to find the relations, to find the problem, and to start the treatment. Later on, I will explain more about phase 1 and phase 2 TM joint treatment. To introduce the appliance, to introduce the treatment, I will show you a video. In the next 30 minutes, I will show you a few videos that will explain perfectly what we are going to treat and what we are able to treat.
The temporomandibular joint, TMJ, is the joint which connects the lower jaw to the skull. It is the most complex joint in the body.
Oh, I wanted to put off the sound. I'm sorry. One more time. Please put off your microphone.
We can hear it.
Yeah. But
The temporomandibular joint, TMJ, is the joint which connects the lower jaw to the skull. It is the most complex joint in the body, moving at two separate points simultaneously and functioning for 24 hours a day. Millions of people around the world suffer from symptoms associated with TMJ disorder, or TMD. These problems can come either from the joint itself or from the surrounding muscles, ranging from mild discomfort and stiffness to severe and debilitating pain in the head, neck, back, jaw, eyes, and ears. Clenching and grinding of the teeth, stress, the occlusion or bite, and trauma to the joint have all been proposed as causes of TMJ disorder. However, these are better thought of as contributing factors. The most common and under-recognized cause of TMJ issues starts in childhood as a breathing and oral muscle problem, otherwise known as myofunctional disorder. Mouth breathing causes the tongue to drop from the roof of the mouth, and this causes an abnormal or reverse swallow. The reverse swallow pushes back on the lower jaw up to twice per minute. This pushes the condyle back into its socket on both sides and displaces the disc, which can cause clicking, locked jaw, and other forms of trauma to the TMJs, while also causing inflammation in the muscles of the head, neck, and back. The relevant pain referral patterns were mapped by Dr. Janet Travell in the 1970s, who was the physician of President John F. Kennedy, showing that a wide range of neurological and musculoskeletal symptoms can arise in the areas away from the trigger points. Since the symptoms are widespread and often seem unrelated, patients go undiagnosed, while their problems persist and worsen over time. Of those who are diagnosed, most don't receive effective treatment and continue to suffer for many years. In order to properly treat TMD, a careful consideration of the TMJs and surrounding muscles is required. But more importantly, the underlying breathing and myofunctional problems must also be addressed. To make this process as simple and seamless as possible, Dr. Chris Farrell, who'd been treating TMD since the 1980s, founded Myofunctional Research Company, MRC, and invented a range of appliances to treat TMJ disorder. Dr. Farrell created the TMJ appliance to determine whether the patient will respond to oral appliances, while also providing immediate relief of symptoms. To go beyond initial symptom relief, MRC has developed the Myosa Tmjbds system. The Myosa system involves the Myosa appliances, which open the bite and bring the lower jaw forward into the correct position. This effectively opens the airway while awake and asleep, as well as correcting tongue position and transitioning the patient to nasal breathing. The Myosa activities and myotalia appliances further assist by correcting breathing and muscle patterns, as well as improving the strength and tone of the oral and airway muscles. Other techniques are also used to relieve inflammation in the jaw joints and surrounding muscles. Contributing factors associated with TMJ disorder, which is an important first step towards rehabilitation. The next step is to collect records, so speak to your Myosa practitioner to get started today.
So for those who are familiar with MyoBrace system, who are using MyoBrace appliances, the idea is the same. I always explain every lecture that you can have a child of 5 with an infantile swallow, reverse swallow. You can have a 12-year-old with orthodontic problems. You can have a 25-year-old with teeth grinding issues. You can have a 40-year-old with TM joint problems. You can have a 55-year-old with snoring problems, and you can have a 65-year-old with OSAS problems. The first part, the main causes are the same: breathing, incorrect swallowing, tongue thrust, and tongue position. And that's the first focus. I will talk about two things. The first part will be about the TM joint appliance, and the second part will be about the BDS appliances, and of course a combination. But this depends on the problem of the patient. The first appliance I want to talk about is the TM joint appliance, and this is the main appliance that we're going to use for diagnosis and we're going to use for treatment. It's a really easy appliance to use and to sell because by doing the muscle palpation, by doing the diagnose part of the treatment, you are going to check the patients in the neck, head, back, and shoulder area if there is any pain, if there's any complaint related to the TM joint compression. We're going to check the muscles left and right in this area, and then we're going to fit the TM joint appliance. We're going to reset for 1 minute. I will show you the video later. And then we're going to do the same test again. And immediately the patient will feel relief. And if a TM joint patient, what is often suffering for many years with pain and all kind of problems during the day and during the night, and the moment they feel relief, they want to have this appliance. So it always starts with the diagnosis first, with a muscle palpation test. On the website, you will find this test in the presentation, and I will show you some part of the videos in this lecture to explain you how to do this test. With TM joint treatment, it's often a mix of problems. There are many different causes, but there are two main groups. It's the intracapsular problem and it's the extracapsular problem. Normally, the TM joint splints that are used worldwide are hard splints, like the Galp splint. Hard splints are very effective. They are relieving pain, they reduce clicking, etc. But it's only a symptom relief. This means by using any hard splints, there is no cause correction. So maybe after 1, 2, 3 years, after treatment, you stop and the pain will come back. In this treatment option with the TM joint appliance, including the TMD appliance, we can try to work on both problems, intracapsular and extracapsular. Extracapsular is the software, are the muscles, are the myofunctional problems, and this is treated with a soft splint like the TMJ appliance. Intracapsular is the hardware, is the bones, the teeth, and the joints. And this is treated with hard splints, like the TMD appliance. And these two appliances can be perfectly combined in one treatment. We can use the TMJ appliance, TM joint appliance at nighttime. And we're going to add the TMD appliance at daytime. That's one possibility. We can use them like phase 1 and phase 2 treatment. We can start with the TM joint appliance for 4 to 6 months, and then we can continue with the TMD appliance, another 4 to 6 months. But the most common option is using these two appliances both at the same time. TM joint at nighttime, TMD during the day. I will explain you both appliances. The So this is really decompressing and pain relief immediately. There is a tongue tag. There are myofunctional features to do myofunctional training on breathing, on swallowing, and on tongue position. To explain you the idea of the treatment, I would like to show you this short video as well, because this perfectly explains how the appliance is used as a standalone or in combination with other appliances.
Hello. In this video, we'll be looking at the TMJ appliance, which was the first appliance created by MRC in 1990. Since then, it has been used by practitioners from all around the world to help countless patients with symptoms of TMJ disorder. Many traditional approaches for TMJ disorder involve expensive and time-consuming laboratory-made appliances that only focus on the occlusion, which is only one contributor to the problem. This could be why many patients with TMJ disorder continue to receive ineffective relief of their symptoms while demanding simple and immediate solutions. Diagnosis of TMJ disorder can also be complicated, since the problem involves a complex interaction of breathing and myofunctional disorders which cause pain and dysfunction in the head and neck region. The symptoms are diverse and widespread, making it difficult to know whether the patient's symptoms will respond to oral appliances. The TMJ appliance is a single-size prefabricated appliance which is ready to use out of the box, allowing the patient's response to be assessed immediately. Because of this, the TMJ appliance is used as part of a diagnostic procedure. It targets the underlying breathing and myofunctional causes of TMJ disorder while decompressing the TMJs and providing an immediate solution for patients who have symptoms, avoiding inefficient and time-consuming laboratory-made appliances for immediate and effective symptom relief. Although the TMJ appliance is great for diagnosis of TMJ disorder and initial symptom relief, a more involved treatment intervention, such as Myosa for Tmjbds, is required once diagnosis is confirmed for further long-term symptom resolution.
So this means that the TM appliance is always the first part of the treatment, and then depending on the patient, on the problem, on the compliance, on the treatment, we can continue the TM joint treatment with the Tmjbds appliance, like the S1H, S1, S2, and S3, which I will explain later. First, I want to go back to the additional appliance, the TMD appliance, because the TMD appliance is based on the Galp splint, and the Galp splint is an appliance. One moment. The Galp splint is an appliance that is still used in the lab. It's the most common, most used hard splint for jaw clicking, decompression. Many patients are wearing it almost 24/7 to be able to work through the day and to function during the day because of the problems that they are facing. So this is still, till today, a very common used appliance. Therefore, we have the TMD appliance in a prefab moldable version. Moldable means that we're going to boil it in 2 minutes in boiled water, 90 seconds, 2 minutes, and it became soft. It will become soft and we can position it in the mandible. I will show you this in the video. So this TMD appliance is moldable and can be customized at the patient. And within 5 minutes, the patient goes home with something in between to decompress and to reduce the jaw clicking. And the good thing is of this appliance, it's worn during daytime. This means at nighttime, you can still wear the TM joint appliance. So you can do the mix like I mentioned before. This is the video shortly explaining you the TMD appliance and the molding instructions. These molding instructions are the same for all the molding appliances that we have. We have a few more, but the instructions are the same.
Hi, this video is about the Myosa TMD appliance, which is used as an auxiliary appliance in Tmjbds treatment. The TMD is a prefabricated appliance which can be custom molded to the patient's mouth and comes in 2 versions, one with a 4mm opening and the other with a 6mm opening. The appliance is an auxiliary appliance that is used in conjunction with the Tmjbds appliances. It is specifically designed for advanced internal derangements of the TMJs, such as a closed lock or painful clicking of the jaw, where the patient needs immediate decompression of the TMJs for 24 hours a day. The TMD appliance meets this demand and should be worn at all times when the Tmjbds appliances are not used. Before we look at how the TMD appliance is molded, let's take a closer look at the appliance design. We start off by removing the TMD appliance from its blister pack. And inside, we can find the insert card, which contains a variety of useful information for the practitioner and the patient, including how to mold, use, and clean the appliance. Now let's take a look at the appliance itself. The TMD appliance is only worn on the lower jaw and molded to whichever jaw position is most optimal. This jaw position can be changed at any time during treatment by remolding the appliance. It also has a low design profile, which has minimal impacts on speech. Let's now take a look at how the appliance is molded by Dr. Chris Farrell, the founder and CEO of MRC and the inventor of MRC's appliances. First, boil approximately 1 liter of water. While the water is boiling, practice the molding technique with the patient. Once the water is boiled, carefully pour the water into a bowl. Immediately place the TMD appliance into the boiled water for 60 seconds with the base of the appliance facing upwards. Next, gently lift the appliance out of the boiled water and shake off any excess hot water for no longer than 2 seconds. The appliance should immediately go into the patient's mouth. Line up the center of the TMD appliance with the midline of the lower teeth. Then, press the appliance firmly against the lower front teeth and molars until you feel the teeth sink into the appliance. Bring the patient's lower jaw to the optimal position and instruct them to bite as hard as they can for 20 seconds. Remove the TMD from the mouth and cool it by holding it under running tap water for 1 minute. Then, reinsert the appliance back into the patient's mouth and check for a firm fit. If you are unsatisfied with the fit, you can repeat this molding process until you achieve a tight fit. This gives you an overview of the TMD appliance. For more information on the TMD, please complete our online training.
I'm really sorry, my voice. I'm sorry. In the video was mentioned about 60 seconds. This, I would say 90 seconds minimum till 2 minutes to make it good soft and enough soft to press it over the teeth. Sorry. The Gelb splint is a prefab part I just explained. What often happens is when the TMD appliance is a success and the patient is really helped by this appliance, of course, what you can do is use after 6 months another TMD appliance, or you make a laboratory version, and this you can use more during daytime, longer. You can also use it during nighttime because it got clummus that is tight on the teeth. So this is, of course, customized. This is laboratory made and a bit more comfortable because it's not prefab. But the idea is exactly the same. So let's have a closer look to the TM joint and what we are going to do, because the TM joint appliance, like I said, is going to be used for diagnosis and muscle pull patient check, and is going to be used for treatment. The TM joint is a very complex joint. It's three-dimensional and it's moving in any direction. And it's surrounded by muscles that are related, and any position change, any compression in the TM joint will have an effect on the muscles in the head, neck, and shoulder area. I may not have to explain everything what's here. It's also in the course, but we have the articular disc, we have the articular tubercle, we have the head of the mandible condyle, we have the glenoid fossa, and we have the retrodiscal tissue. So this is how the TM joint is the anatomy of the TM joint. What is more important are the muscles, because the moment we start the treatment, the first thing we're going to do is checking the 8 muscles in the head, neck, and shoulder area. We're going to check the temporalis on both sides. We're going to check the masseter. We're going to check the lateral pterygoid. We're going to check the medial pterygoid. We're going to check the sternocleidomastoid. We're going to check the temporalis mandibular joint, the TM joint itself. We're going to do the posterior cervicals and the trapezius. All these muscles are in relation with the TM joint. And if there's any compression, any change in position, any incorrect movement, these muscles will have an effect and will have an issue. They will be sensitive, they will be painful, they will be hard, they will be tender, etc. And that's exactly what we're going to check. Therefore, we have an evaluation form. After this lecture, I will send you a doctor's package. In this doctor's package, you will find all the videos, all the information about evaluation, muscle palpation, and diagnosis. So everything that I show you today, the videos, is in this package as well. These videos are also on the website. Again, if you want to learn yourself how to do the muscle palpation, it's very easy to go to the website, and by following step by step the videos, you can check the surrounding muscles and see if the patient is having any issues. The idea is simple. You're going to do the test without the appliance. Then you're going to position the appliance. The system is reset for 1 minute. And then you're going to do the same test again. And then after doing the test, you're going to remove the appliance and you're going to do the test again. So actually, we're going to do the test 3 times without, with an appliance, and again without. Why we're going to do it again without? Because immediately when we remove the appliance, the pain is back. And sometimes in videos, it sounds very tricky and like a selling appliance, but it's really the truth. If you have a patient with TM joint problems, do the test and feel the relief the appliance will give the patient.
Here is Dr. Farrell now to demonstrate the procedure.
I'm just going to test all the muscles around your head and neck just to see which ones are tender. So I'm going to press on the muscles of the both sides, and you just let me know which ones are tender.
Okay.
So temporalis, right side, anterior fibres, tender on the right side, that's a plus. Left side, probably a plus on the anterior fibres. Masseter, right side, there's tenderness on the right side for sure. Left side, there's some trigger points in the superior and inferior. So probably a plus on plus on both sides of the masseters. Lateral pterygoid is always tender, so that's quite, I won't press too hard, and tender both sides. So lateral pterygoid plus both sides. Sternocleidomastoid, really not much tenderness at all. Left side, all okay. Posterior cervicals, superior, quite tender, most of the right side. So plus right, plus left. Further down, again, in the posterior cervical, some trigger points there. Trapezius, right side trigger point, plus. Left side, a plus. So trapezius, right side more than the left. TMJ, I'm just going to press on the right side, the tender. Left side, both TMJs tender, both plus. Open and close, open, close. We've got a right side opening click, reciprocal click, probably a anterior displaced disc with reduction. Doesn't feel like much degeneration. Just check your opening and close. Opening is a little bit restricted. Okay, that completes the muscle and joint palpation. Let's go over and we'll just discuss what we found.
Okay.
So this is the first part of the muscle palpation. I apologize for my voice. It's getting better now. So now the patient is evaluating the whole evaluation. All the trigger points, all the problems that we were facing are discussed with the patient. And then the patient comes back and we're going to do the second part of the diagnosis. And this is the same muscle palpation test, but then including wearing the team joint appliance. One thing must be clear, you don't see it in the video, is that the moment you're going to wear the appliance, there is a reset of 1 minute. Patient can stand, patient can walk, patient can stretch to reset the system with a new mandible position that they will have in the TM joint appliance.
So, Michelle, this is the TMJ appliance, which we'll use for diagnostic purposes. So you want to just take it out of the box?
The practitioner issues a TMJ appliance to the patient and instructs them to place their tongue on the tongue tag and breathe through the nose.
Yes, right. And now I'm just going to palpate the same muscles again and see if we get the same response.
Okay. This is 1 minute later.
So, temporalis. No.
The practitioner continues to palpate the muscles with the TMJ appliance in place and examines the improvement in the patient's response.
No pain. You just take that back out in and just put that back in. And you wait a couple of seconds and you retest just to make sure, and you see that those muscles, the pain has returned again. It's more tender. So it's definitely less tender with that appliance in.
The patient is to wear the appliance for a minimum of 1 to 2 hours while awake and overnight while asleep for another 2 weeks. It may fall out overnight in the initial stages, but with persistent daytime wear, this will improve.
So the TM joint appliance is a soft appliance working on decompressing the TM joint, is working on habit correction of swallowing, tongue position and breathing. Standard, it's worn nighttime 1 hour per day, like all other appliances that we have. And it can be combined with a TMD appliance during daytime. So we can do phase 1 TM joint and after a few months TMD plus, or we start together TM joint at nighttime and TMD in daytime. This total treatment is between 4, 6 and 12 months, depending on what you do, but average is 4 to 6 months. After 4 to 6 months, there will be evaluation again, and then we're going to decide what we're going to do next. Is this enough treatment for the patient? Can we continue this way to feel the relief that they need to feel? Or do we need another part of the treatment? And then we're going to talk about TM joint BDS, because there are many patients that have TM joint problems in relation with snoring issues, obstructed sleep apnea issues, etc., grinding issues. So the next system that I will talk is often a second part of this treatment. Not always, but in a lot of TM joint patients, we are able to continue with the TM joint BDS series. I will do a short introduction of this BDS system as well.
As the medical and dental community has become aware of breathing disorders, or BDS, as a major contributor to a wide range of medical and dental problems, attention must be turned to an effective treatment. BDS is caused by a range of factors, including underdeveloped jaws, dysfunctional breathing patterns, and poor muscle habits, all of which need addressing during treatment. Two of the most common forms of BDS treatment are continuous positive airway pressure, or CPAP, and mandibular advancement devices, or MADs. CPAP uses air pressure to prevent the airway from collapsing. Although it is highly effective, most patients stop using their device due to discomfort, inconvenience, and other side effects. CPAP is better viewed as an emergency intervention that doesn't treat the underlying breathing, jaw, and muscular factors. This is why alternatives like mandibular advancement devices, or MADs, are gaining popularity. MADs present a more convenient approach to increasing compliance in BDS treatment. However, they too have limitations and side effects. MADs anchor to the upper jaw and pull the lower jaw forward to open the airway. The reciprocal pressure pushes the upper jaw back and can lead to further airway narrowing, while the lower jaw and TMJs are held forward for extended periods of time, which may lead to degeneration and damage. It's also well known that MADs can cause permanent jaw deformations and negatively impact the alignment of teeth.
So again, all the heart splints, the CPAP, the MAD appliance, the mandible adjustment devices, the MRAs, whatever you call them, they are all heart appliances. Very effective.
אני רגע מכינה לי קפה, טוב בבי?
Very successful, but they only symptom relief. And especially in long-term use of CPAP, long-term use of MED appliances, there are even side effects and contraindications. There are research and articles on the website also related to long-term use of CPAP and long-term use of MED appliances. So we have to find a way that is more focused. What is happening here? So we have to find a way that is more focused on function and decompression. Therefore, I don't know what's on my screen, but I see yellow lines.
It's the S1, S2, S3.
Yes, but I see yellow lines appearing on my screen.
Yes, I don't know why.
I really don't know what that is. Anyway, strange things happening here. So now we have to be clear. This can be a second part of the treatment that started with the TM joint appliance. Because the patient is having obstructed sleep apnea in any level, the patient is snoring in any level, the patient is severe mouth breathing, or having other issues that we are not able to relieve or to treat with a TM joint appliance. But now I'm also in a situation that not all patients are willing to do something. A lot of snoring patients, a lot of patients with mouth breathing, they are not very eager to do something. So maybe the partner, maybe somebody wants a treatment, but the one with the problem is not the one who is really motivated to do something. He or she knows the problems. There's mouth breathing, there's overweight, there's nutrition problem. So everything is there, but he or she is not willing to do something. This makes it always difficult to sell a full treatment. Even if we want, even if we know the problem, if we can treat the problem, the patient is still not willing to do something. So please evaluate the patient and make sure that they understand the problem. And maybe the snoring problem is not a big issue now, but when the snoring problem becomes sleep apnea, we have another problem. So we have to explain the importance of mouth breathing, snoring, and low level of sleep apnea. Now you see 4 appliances on the screen: the S1H, the S1, the S2, and the S3. The S1H and the S1 are the most used appliances. The S1, I will start with the S1, is the appliance that we start with for snoring patients. If you have a snoring patient and the snoring patient is not willing to have a treatment, this is the appliance that is just doing what we want. It's opening the bite, it's bringing the mandible forward, including the tongue position, and it's reducing the sound. It's like an MED appliance, but then more flexible and myofunctional related. So just for patients that are snoring and the partner is complaining and he wants or she wants to have something that is reducing sound, the S1 is really effective. But of course, the S1 can do more than just reducing sound, depending on the problem. The S1H is an appliance for a more severe level of mouth breathing. You see the breath hold time less than 20 seconds. Breath hold time is a breathing test. There are different breathing tests that we can do. And if the breathing test is less than 20 seconds, it means there is a severe level of mouth breathing. There is a difficulties to breathe through the nose. So the patient needs to have an appliance that he is able to control his breathing, and he should be able to breathe through the mouth because nose breathing is very difficult. So let's start with the S1H, and then we go to the other appliances. Because with the S1H, we also can do an exercise program. If you want to work on the cause of the problem, we need to add exercises. Exercises on breathing, exercises on swallowing, tongue position, and lip seal. And with the S1H, we have an appliance that can do both. That can be worn nighttime 1 hour per day to decompress, to open the bite, etc. And we can do exercises with the same appliance. So the next video is a short video about the tongue, lip, and throat muscle strengthening exercises. These exercises can be done with the TLJ appliance that we have, it will be mentioned, and can be done with the S1H appliance. I really don't know where the lines come from.
Introduction to tongue, lip, and throat muscle strengthening. Patients with Tmjbds have mouth breathing habits which lead to poor strength of the lip, tongue, jaw, and throat muscles. This part of the Myosa activities aims to address this problem by improving the function of the airway and oral muscles. After the first phase of treatment with Tmjbds appliances and Myosa activities with myotalia, further treatments such as jaw widening and ENT procedures may be considered. However, this first phase of muscle strengthening with jaw exercises can also improve the shape of the upper jaw and airway by improving breathing, tongue, and lip function. Successful treatment depends on your effort and compliance with the Myosa program, which will vary with each individual. The Myotalia TLJ is a tongue, lip, and jaw exercising appliance. When combined with throat muscle activities during the head tilt variation, the TLJ strengthens the throat and airway muscles to assist in preventing the airway from collapsing. Myosa activities with the TLJ involve isotonic and isometric exercises. Isotonic exercises are repeated exercises which contract the muscles, such as lifting a weight. Isometric exercises are used to maintain muscle tension, such as holding a weight in a static position. So, there are two sets of myotalia activities. First, isotonic, then isometric.
So this is always the same program. By using the TLJ appliance or by using the S1H appliance, you can do the exercises on two ways. Isotonic, isometric, and with the head straight and the head tilted. This means with one appliance, we can do 6 different exercises in 2 different ways and 2 different head positions. So there is 12 different exercises we can do with one appliance. You can use the TLJ to add with an S1 or an S2, or you can use the S1H and you have 2 appliances in one. So the S1H is for the more severe mouth breathing patients, snoring patients, BDS patients, and the TM joint of the S1H is an appliance that makes it really easy to breathe through the mouth. And by the tongue and the lip tube, the patient can control their breathing. So the airflow goes from the lip tube out of the tongue tag. And by pressing the lips or by putting the tongue in the correct position, they can control the breathing. It's a really comfortable appliance to breathe through your mouth. There's hardly any resistance. So if there's any blocked nose or issue with nose breathing, this is the first appliance you're going to use. So again, the breath hold time is some way a sort of test that you can easily do. And this is often telling you which level, which appliance we're going to start. Less than 20 seconds is the S1H. Between 20 and 30 seconds is the S1. 30 seconds plus it's the S2. The Myosa S1, again, is the most used appliance for us for reducing sound for snoring. So any snoring patient on any level, the S1 can be used. Of course, if needed, you can add a TLJ appliance and you can do exercises to work on the causes, to retrain breathing, to retrain the swallowing, and add any other issues. The S2 is an appliance that is used often when there are also TM joint problems. So we can start with the TM joint appliance and then continue. But if the TM joint patient, or if the patient is having TM joint problems and some breathing disorder problems, sleep disorder problems like snoring or severe mouth breathing, then they also can use the S2. The S2 is really comfortable on the TM joint. It's also decompressing the TM joint as well. And at the same time, there is enough opening in the front breathing holes to have mouth breathing possibilities. With a TM joint appliance, you need to have nose breathing because it's not possible with the TM joint appliance to breathe through your mouth. So on any level that mouth breathing is more common than nose breathing, or nose breathing is limited, it's better to use the S2 instead of the TM joint appliance with almost the same effect and idea. Also, the muscle pull patient that I just showed you can be done with the S2 appliance. So the TLJ or the S2 appliance. Okay, I hope that's clear. The S3 is the last stage of treatment. This is not a very common used or often used appliance because not many patients are in full treatment with the S1, S2, and S3. But if you have a patient understanding the problem, willing to do something, the treatment starts with S1H or S1, and then continues with S2, and then the retention phase is the S3. So it's the last phase of a TM joint BDS treatment. But again, and you will recognize this, not every snoring patient is willing to do something, unfortunately. So there's a lot of work. There's something for us to do because we know the problem already with mouth breathing, with snoring, and if we do nothing, this can become sleep apnea, and we have a more severe problem. There are many different evaluation forms: orthodontic evaluation form, TM joint evaluation form, BDS evaluation forms. All the evaluation forms I will put in a file, in a link you can download. I will send it this afternoon or maybe tomorrow morning. And you can use these evaluation forms in your practice. Of course, if you need more information, you can contact Shomit and you can have what you want. Probably they have something in Hebrew as well. Everything I will send you is available in English. What we also have, I would like to announce, is the 4-day summit in September. It's a 4-day event, and why I'm showing this now is because 70% of this program is related to TM joint and BDS, and only 30-40% is related to orthodontics. So for those who are interested in learning more about TM joint, BDS, snoring, apnea, and etc., have the possibility to come to the 4-day summit. It's from the 23rd to the 26th of September. It's a 4-day event. You also can sign in for 3 days. We have 14 international speakers. We have workshops daily and lectures daily. And then we have the activities application form, as well for Myobrace, as well for Myosa, Myosa TM joint, Myosa TM joint BDS. We have fast track programs. We have fixed active programs to support, to add on your Myosa Myobrace treatment. So if you have a TM joint patient, there is a 9 exercise program for that. If you have a BDS patient, there is a 9 exercise program for them. The same for Myobrace, for kids and for adults. So if you are interested to have access, to get access to this online activities program, you can scan the QR code, you will come to the website and you see all the possibilities. In total, we have 7 different programs. But as a non-member or provider, you can get access to the fast tracks, and we have 4 fast track versions. This is the information, info@myresearch.nl, if there's any question for me or some information. And here there are the websites. myresearch.com is the professional website. myobrace.com is for patients. Myosa is for patients and the professional, and the MRC activities as well. The MRC activities have an entrance for doctors, and the MRC activities have an entrance for patients. Are there any questions? Apologize for my voice and some coughing. Apologize for crazy yellow lines on my screen and the recording issues. If needed, I can do the recording again tomorrow or the next week, and I can send it to Shlomit. Or the recording was working and is okay, then please let me know.
No, it's okay. It was working, but I have a question regarding the TMD. When you put it below, okay?
Yeah, it's always on the menu.
Yes, there are people that used to have braces and they have a fixed splint. Is it working with it?
Actually not. If you have any fixed braces on the lower and you want to mold the TMD appliance, you're going to press the appliance over the teeth and you will be pressing on the brackets. It will not go over the brackets, but it's a soft thermoplastic warm material, and that's what you're going to press in the brackets. And that's not what you want.
It's not working.
No.
Okay.
I'm not saying it's not working. It's not made for that. Of course, you can try. You can always remold it. So if not working, but also be careful that you don't press off the brackets, because after positioning of the TMD appliance, you're going to bite for 20 seconds to make an imprint. So there, I think there will be a risk also that you will bite off the braces. So I would not do that. No.
Okay. Thank you. Anyone else have a question?
The course is available online for all of those that are interested in learning more about TM joint, but especially I think the muscle pull patient test, because you need to do this test and you will feel and you will notice what the patient will feel different. The pain before and the relief after, yeah.
Yes, with using and without using the...
Yeah.
Okay.
It's not my idea to sell it like this, but if you do the muscle pull patient test and the patient feels a relief, they want to have it because it's something that they have a relief, what they didn't have for a long time.
Yes, they straight feel that when it's not hurting them.
Yeah,
the change.
Exactly.
Okay.
And then the same thing when you're gonna remove it again after doing the test, the pain is back immediately.
Okay.
Yeah. So again, everything is on the website, the courses, the muscle pull patient, the products, you have...
יש קורס ספציפי ל-TMJ ולכל הבעיות מפרק הלסת, מי שמעוניין, אז זה כמובן באונליין, וזה בחינם, הקורס הזה, אז אתם יכולים להיכנס לאתר, מי שרוצה, אני אתן לו את הקישור, ואתם יכולים להיכנס ולעשות את הקורס הזה, וכמובן את כל שאר הקורסים של מיופונקציונליות. אם מישהו יש לו שאלה שרוצה לדעת או לשאול, אז עכשיו זה הזמן, ואם לא, אז אנחנו נגיד סוף שבוע נעים. קישור לאתר של סילמט, או לאתר של מיופונקציונליות.
I also want to thank Shlomit for the support. You have a perfect knowledge and understanding of everything. So all the doctors here, for the questions, of course you can come to me, but Shlomit is well experienced already within a year. So I'm really happy and I want to say that to work with you together. So thank you for that as well.
Thank you. זה הקישור לאתר של ההפצה שלנו, של המוצרים. היום יש לכם מבצע, כמו שאמרתי, 1+1, מי שרוכש. זה הקישור ל-Myobrace. Myobrace, this is the website of the MRC. Just a second, I will send it to you. The link to the website. This is, and then you have to register and you can do the courses.
Yeah.
This is the MRC. הנה, פה, באתר הזה, בלינק ששלחתי לכם, זה האתר, הקישור לאתר של MRC הבינלאומית, ופה יש לכם אונליין courses, ובאונליין courses there is a free TMJ course. השני מלמעלה. השני מההתחלה זה ה-TMJ, Introduction to TMJ Disorder. This is the one.
Yes, that's the one. There is a free introductional course. There are 2 webinars for free. The Team Join course is for free.
Yes.
And when you do the monthly subscription or when you pay for 1 month for 1 year, you can do the Myosa activities, the Myobrace activities, Myosa.
All the rest. You have 3 for
then
free and then you can start.
Yeah. Arts expansion, BWS, there's a really good course on that as well. A workshop to bend 5 cases of BWS.
BWS, yes.
Yeah.
Okay. If anyone has another question, that's the time.
Thank you very much for listening.
Thank you very much, Niles, for
some
supporting
interruptions.
us. And
A pleasure. And Shlomit, when you need anything after this course, let me know. And when you
Okay.
have news for the event after summer, let me also know. The one-day event.
okay, for the one-day event, I will let you know. Thank
I
you.
think it's a good idea. Yes.
Yes.
Keep in touch. Thank
Oh,
you
we
very
will. Thank you. Bye-bye.
much. Bye-bye. Bye-bye.